Hi, I'm Lachey, and today I'm going to demonstrate the irrigation of a wound, the culture, and also placing the dressing on the patient. Before we begin, I've already checked my patient. I've changed or taken off the dressing. I've checked the patient for pain and administered his medicine 30 minutes prior to doing my procedure. And I've also made sure that I've assessed the color, any drainage, or any abnormalities of the wound. So I've laid down my sterile field. I'm going to perform hand hygiene, and also I've placed my patient on the truck and in a comfortable position. All right, so the first thing we're going to do is we're going to set our wound culture next to the patient. This is unsterile, so we're going to open it this way. Okay, set that there. This is my sterile field, and I've also placed my biohazard bag. All right, so the next thing we're going to do is place opening this away. Okay. All right, now we have our bottle, which we can just kind of drop there. And then we will use this also to place our sterile dressings in. So I'll put some saline in there. Okay, and we also have our abdominal pad. This was a little harder to get out, so what I'm going to do is I'm going to take my sterile tongs and I'm going to just place the pad right there. Okay. Okay, now I'm going to put on some clean gloves. And I've already performed hand hygiene. Okay. Going to take this. I'm actually going to take it over here and just pour some in here. And then I'm also going to pour some in here for my sterile pads. And also with the label needs to go in the palm, okay? All right. All right, so we're going to start by irrigating the wound, and I'll place the truck under my patient. So when we irrigate this wound, we want to make sure that we irrigate it until the water or the saline runs clear, and we're irrigating from top to bottom, making sure that we get all of that out and do not touch the wound with the syringe. And we can do this until it runs clear. Okay? Okay. Now that we've irrigated, we can go ahead and grab our culture. So we've opened this. We want to take the top off, take our swab, and then we're going to get the granular tissue, making sure that we get just enough to get the lab completed. And then we're going to place it in gently without touching the sides. And we're going to label this with our initials, time and date. And we're going to have that on the side for our lab. Now that we've irrigated and done our culture, we can now do our actual sterile dressing change. So we're going to put on our sterile gloves. Had to catch myself, but we're going to hold the top here, then placing the two underneath. We're going to slide our fingers in like so. All right, now that's on. Okay, So we have our sterile gloves on in our sterile field. Now the first thing we want to do is we're going to have 2 dry, 1 wet in the ABD. So we're going to dampen, we're going to dampen 1. And for this, we want to wring it out and make sure that we are fluffing, not stuffing. So we're just going to fluff the wound, not making sure that it's packed it too much, right? That's perfect actually. All right, and then we will place our 2 stills here. Okay, then our ABD pad. Then we can window tape. All right, and then with our Sharpie, I would actually take my gloves off because we're not worried about the sterile field. But with my Sharpie or my pen, I'm going to initial with my initial the date, making sure that the patient is not in pain as I do this, and the time, which now it's 4:30. So it's going to be 16:30. All right. All right, and then once we're done with that, we're going to document our findings and make sure that we're placing everything in the biohazard bag here. And we're going to get this down to lab right away, also with our initials, date, and time on it. And that's going to be that. We've checked our patient, and that's it. Hi, so today I'm going to show you how to apply an ACE bandage wrap. I've already performed hand hygiene, and I've assessed my patient for any edema, any swelling, and any breakdown of the skin. So we can go ahead and don gloves if we need to. We have our ACE bandage wrap here. And the main thing I think about this is the importance of providing support for the patient's extremities. So I have my patient sitting here with 1 foot on my leg. All right, so we're going to start at the base of the foot. And we're going down twice. And this ACE bandage is just a little big for my client. So we're going to go over the ankle. Then we're making sure that there are no wrinkles. Going over the ankle, back down over the foot, back over the ankle, making sure that there aren't any wrinkles. Okay, until we get to the end. Once we get to the end, we can go ahead and place the holders inside, being careful not to poke too hard. Alright, and that is how you place an ACE bandage. It's a little wrinkled up here, but that's because it's been in the pack for a while. But other than that, we're making sure that there's no wrinkle and that it's not too tight. And so this is how it should look. And then, okay. Once we're done, we can go ahead and document, and that will be it. Thank you.